And to speak a little bit more about this, Dr. Kavita Makan is head of clinical medical COVID unit at the Hani Baragwanath Academic Hospital. A very good evening to you, and thank you so much for joining us, Dr. Makan. Just talk to us a little bit more about what is unique about Hani Baragwanath's vaccine rollout program, other than the fact that we know that it is literally the biggest hospital on the continent.
Thank you, Sabisa, and thank you to the SABC team for inviting me on to speak tonight. I think, yeah, you've hit the nail on the head, really. That's exactly it. Hani Baragwanath Hospital, as we know it, is the third largest hospital in the Southern Hemisphere. We've got over 7,200 healthcare workers actively at present in the hospital. So, any sort of large-scale vaccine rollout is a challenge, but when you have such a massive contingent of staff, it becomes an extra large task. But we've had actually such an extraordinary team behind this rollout process. And, from the time of preparation, which has been ongoing for the past few weeks, from the setup of the site to the logistics behind everything, including the selection process of who gets vaccinated first. And, this is based purely
Can we
on
talk about that selection process and how the determination was made? Was it purely on a voluntary basis, or was it on a scale of who is very much at the front line? And if you could also give us figures, as in how many health professionals you have there on the front line and how many in total actually need to be vaccinated?
So, the priority was always to sort of target those sort of staff that were at highest risk, so with the greatest degree of exposure to the COVID virus. So that was the primary method of categorization. So our COVID unit or COVID team, any sort of medical practitioner or healthcare worker, as well as the clerical staff, the porters, nursing staff, anybody who was actively in the presence of within the COVID wards were prioritized. And we've seen up till now about 240 people vaccinated today, and with again seeing our team being vaccinated first. So the priority was the high risk exposure. In terms of number of staff, actively involved in COVID, I would have to say the entire hospital in some way was involved with this pandemic. Of course, there were frontline workers, people with, great exposure. And our medical team was comprises of over 100 medical doctors that were actively involved in this team. But this is, not taking into account the ICU staff, the obstetric and gynae departments with their own division, the pediatric team. So it was quite a collaborative effort involving the entire hospital staff contingent.
So tell us a little bit more about the preparation, because I know that training also had to be done, including ensuring that healthcare workers also understand the logistics of that vaccination, the doses, etc. So please take us through that.
Of course. So for the past 2 weeks, we had an intensive education program that's set up. And this involved both virtual meetings through the MS Teams system. We had on-site meetings, so-called town hall meetings, where we had members of staff attend on a regular basis. We also had ad hoc meetings where we took the education team directly to the various departments and spoke directly to the staff members. We addressed any fears they might have had. We answered any questions that they might have had as well. Obviously, we initially were preparing for the AstraZeneca vaccine, but all the while, we sort of adapted to the new rollout and the unique rollout process that we face ourselves in currently.
Now, we did mention the total number, generally the total number of hospital staff at Hani Baragwanath Hospital. Has there been any information forthcoming on when you can expect the next round of vaccine doses? And is there also a specific group beyond hospital staff that your team may have to vaccinate? Because I know other provinces are looking at NGOs and traditional healers.
Well, so at the moment, I think we have, our plan is for the first week to at least vaccinate close to 3,000 healthcare workers. As I said, day one, that was yesterday, we were able to vaccinate 40 people, and that was purely because it was the inaugural day of the vaccine rollout. Today, as I said, 240 people were vaccinated, but from tomorrow, we're looking at vaccinating around 420 people per day. So by the end of the week, we should see over 2,500 healthcare workers vaccinated. This is the priority is obviously to our Baragwanath staff. There is definitely a program in place for including some general practitioners or family practitioners over the weekend. And that plan has been initiated from the Department of Health side. We have a team of 40 vaccinators stationed at Baragwanath on any day, meaning that they can vaccinate at on one session 40 people at a time. So it's quite we're moving at a rapid pace, and we're hoping to vaccinate as many people as possible within the next 2 weeks.
All right, thank you so much for speaking to us, Dr. Kavita Makan, Head of Clinical Medical COVID Unit at Hani Baragwanath Academic Hospital. Thank you very much.